Dana, could you tell me if the swine flu is more severe than the regular seasonal flu for the typical student, and how concerned Stout students should be?
At this point, there is insufficient data because the new pandemic that's out there is so new. I think we need to be as concerned about the swine flu, H1N1 as we call it, as we are with the seasonal flu. It's been, according to the data that we do have, it has been shown that it is affecting the younger population, so the kids, the infants 6 months to 24 years of age, where the seasonal flu tends to hit more of the elderly population, but again, there's insufficient data at this point. As far as Stout students being concerned about it, I think there's always a level of concern, whether it's H1 seasonal flu or just any other illnesses that are out there, so I think there is reason for concern. I think all the students should consider being vaccinated. At this point, we don't have our shipment of vaccination in yet, but hopefully within the next couple weeks we will be getting that.
Do you predict that H1N1 will continue to be a risk in the years to come?
At this point, again, I think there's insufficient data to show us really what the future will bring. I hope at some point that it's going to be not at the pandemic state that it's at, that it will be a risk of more seasonal type flu. And anytime you have seasonal type flu, there is always level for concern, and we've had the seasonal flu for many years now, so I don't think H1N1 is going to go away, but I'm hoping at some point the pandemic level will come down, especially when we start getting enough people vaccinated and getting the word out about how to protect yourself.
Are there any risks associated with receiving these vaccines?
Anytime you inject something into your body, there's always a risk. The biggest risk is that if you are allergic to eggs, you need to contact your medical provider to see if it's okay for you to receive the vaccine. It's more of a risk-benefit issue with the egg allergy. And the reason for that is because of what the preservatives in the actual vaccine. That's the same with H1N1 as well as the seasonal flu. The H1N1 vaccine is made in the same respect that the seasonal flu is. Every year there's a new strain of seasonal flu, so every year they're making a different type of vaccine. So I don't think I know there's been concern about that the vaccine was made too quickly and not enough evidence out there showing that it's effective, but it was made in the same respect as the seasonal flu.
Does the Students' Health Center have any seasonal flu vaccines left for Stout students?
We do have a very limited supply yet of the seasonal flu vaccine. We did do a flu clinic a few weeks ago, and I think we gave 180 doses. We possibly have 20 left at this point, and at this point we're just using it if students call and they need it, or based on the provider's discretion for students that haven't received it. And again, those high-risk categories that I spoke about. Just some information for students. There's on the Stout website as well as the Student Health Services website, there's information regarding H1N1, things to watch for, signs and symptoms that would be showing that you could possibly have H1N1. At this point, we are not doing any testing just because of the cost of the test. Basically, we're treating based on symptoms. High-risk groups that need to be really concerned are people that have comorbidities such as asthma or diabetics, pregnant women, or people that live with or care for kids 6 months and younger. Those are considered high-risk groups, and those should be the groups to get the vaccine first. As far as the vaccine that we will be administering here, we're hoping to do a flu clinic, but again, at this point, we don't have our shipment of vaccine, but as soon as we get it, we'll be putting an announcement on the daily email as well as our website, letting students know where the flu clinics will be held and what they need to do to get set up for that.